do you think causes cancer?
Bad health habits cause cancer. Smoking causes cancer. If you drink heavily, that causes cancer.
I don't know, just not really being careful. I mean, there's a lot of stuff.
And what do you think cancer is exactly?
Cancer is like cells that grow in your body and it's bad. I don't know what they do exactly, but they're not good.
Do you know the 4 types of cancer?
Breast, liver, lungs, and brain.
Do you know them?
No, I don't.
Do you want to take a guess?
Is that what you're talking about?
Kind of.
Okay. Or are you talking about like skin, breast, that type of stuff?
Do you know any cancer preventatives?
A lot. Smoking, stop smoking, exercising, eating properly, getting proper rest. Staying healthy.
Anything else?
Avoiding stress.
Welcome to Cancer 101. Cancer is defined as the uncontrollable growth of cells. This is a normal group of cells. This is a cancerous group of cells.
There are 4 main types of cancer: sarcoma, carcinoma, lymphoma, and leukemia. Our first main type of cancer is leukemia.
Leukemia is the chronic disease that gives you an abnormal increase number of white blood cells in the tissues and blood of your body.
Let's check in with Sana and Mackenzie as she finds out what she can do to prevent leukemia.
Hi Mackenzie, what brings you here today?
Hi, well I've been getting quite sick very often. I have lots of appetite, my breath shortens easily, and I feel really tired.
Well, that's not good. We'll have to do a complete blood count and an x-ray. Do you smoke or drink at all?
Nope.
Well, that could have been a reason for your symptoms, but I guess that's good.
Hi there. I'm here with your x-ray and blood cell count reports.
How are the reports?
Well, it seems like your white blood cell count in your blood is higher than normal. Your other reports came out fine, but it's not normal for your white blood cell counts to go so high.
Is that really bad?
No, not yet, but right now you are highly susceptible for getting leukemia. Leukemia is a cancer that is caused by the increase of white blood cells, often in the blood, bone marrow, and tissues.
So I don't have leukemia, but I have a high chance of getting it?
Yes, because we caught this very early, there is a way to prevent it.
Okay.
Well, I have Dr. Shrama come and explain it to you.
Hey, I have some good news for you.
Great.
We have a pill that you can take which will regulate your blood cell count. Take this pill called PTR twice daily, once after breakfast and once after dinner.
That's easy. Are there any side effects?
That's a good question. And yes, there's one small effect. You might have a feeling of depression for a week after you take it. If this lasts longer than a week, you should consult your doctor.
Okay, thank you.
I hope you start feeling sooner better.
The pill prescribed in the previous scene is an MRMS med product. The pill works by entering the bloodstream, and attacking unnecessary white cells while attacking good blood cells.
Our next scene gives us an informative view on lymphoma.
Lymphoma is the disease of tissues. Lymph meaning malignant or life-threatening, ona meaning tumor or lump.
When someone thinks they have lymphoma, they may feel lumps on their neck. They may also feel lumps in their armpits and their abdomen area. These lumps can cause pain and even harm the infected area.
I have friends who have suffered from lymphoma. They experience things such as unexplained weight loss, fever, soaking night sweats, severe itching, and pain and swelling in certain areas of the body.
Risk factors of lymphoma include age, gender, radiation exposure, family history, weight, and certain infections or diseases.
The causes of lymphoma are rare, but when they happen, they can be deadly.
Having a weakened immune system is something that can certainly lead problems with cancer later on.
An immune system can be weakened by many factors. For example, a person with AIDS is 50 to 100 times more likely to develop lymphoma.
People should consult a doctor about lymphoma if they have been exposed to pesticides, herbicides, or water contaminated with nitrate.
Taking certain drugs may weaken your immune system, increasing your risk of developing lymphoma.
Doctors told me I was at risk for developing lymphoma because I work around herbicides. A prevention method they prescribed to me was electrolyte therapy.
Electrolyte therapy is when you send electrolytes into your tissues. The electrolytes calm the tissue, slowing down the development of cancer. You can achieve this in 3 simple steps. Buy an electrolyte blanket, which can be found at mrmsmed.org. Turn it on for 20 minutes a day and see great results.
Risks of this treatment include rash, overly itchy skin, and dry skin. If these or any other symptoms occur, see a doctor.
Lymphoma is very serious cancer that can destroy lives. By learning about these risks and preventions, you may be able to save yours.
Electrolyte treatment has changed my life. I no longer have to worry about developing lymphoma. Thanks, MMRS Med.
That was a touching story about how early preventions can save lives.
Yes, it was.
Our next type of cancer is carcinoma.
It is a skin or tissue cancer that can arise in the stomach, colon, liver, and lungs. In this example, the patient has susceptibility for stomach cancer.
Now here's an example of how not taking preventative measures can dramatically change an outcome.
Doctor, I think I'm sick.
What's the problem?
I puked up some blood.
Blood?
Yes, I ran in here from the bathroom down the hall as fast as I could.
Well, let's get you in a bed to rest while I schedule some tests for you.
I'm here to find out if I'm susceptible for carcinoma.
Well, do you have any family members who had this type of cancer?
Yeah, my grandfather had stomach cancer. He didn't exercise often.
Well, we can give you some preventative medicines for stomach cancer.
That would be great. What can I do?
You can start by having some tests done to see if you are perfectly healthy and not harboring cancer as we speak.
Are you here for an MRI?
Yeah.
Well, you should hold up while we get things ready.
Okay.
Well, your MRI seems fine. You have no illness. Better safe than sorry. I suggest you keep yourself healthy through daily exercise and a controlled diet. Also, take a preventative tips, like building your immune system so you won't get sick easily.
That sounds like a good idea.
I'll set an appointment for you to see an MRMS Med prevention specialist.
So you want to know how to prevent yourself from getting cancer, am I right?
Yep, everything you have.
Well, I recommend that you drink this. It is called Carcinomore. It will build your immune system and help attack Helicobacter pylori.
Helicobacter what?
Helicobacter pylori, a stomach infection that may cause stomach cancers. This will keep you from getting the infection that gives you stomach ulcers and possibly cancer. So you will be a less likely candidate for stomach cancer.
Great, thanks. Oh, this stuff is nasty. Oh.
If the patient had taken the preventative drink called Carcinomore, she would have been able to prevent the cancer, and she wouldn't have had to come back to the office puking 6 months later.
It's too bad. She could have lived a life free of cancer.
Our next cancer is sarcoma.
Sarcoma is a very serious form of cancer. It is a cancer that arises from transformed connective tissues in a cell.
These cells originate from embryonic cells, which form bone, cartilage, and fat tissue.
Let's check in with our new patient, Mrs. Linda.
Miss Linda here is an elderly woman who has had many falls. We have been monitoring her in the hospital for many months now.
The doctors say I have a high susceptibility for getting chondrosarcoma, a type of cancer that affects the cartilage because of my falls and my age.
We are mostly worried about her pelvic bone. If chondrosarcoma starts there, we usually have to amputate.
In fact, there is a woman we treated for chondrosarcoma named Janice Olson up in Canada.
Yes, we thought we would need to amputate her leg, her lower spine, and half of her pelvis.
That wouldn't be such a great way to live.
No, it would not.
Because of this, we decided to try the first pogo stick effect.
This means we fuse the good leg to the body with a reshaped bone from the amputated leg.
I don't think I would want to live like that.
No worries, you don't have chondrosarcoma yet, but in the meantime, we can take these preventative measures.
There are many forms of preventative equipment, but the best comes from MRMS Med.
That's right, MRMS Med just came out with a wonderful new product that can help prevent chondrosarcoma.
It is the Chondro Tube.
It will surely be able to help Mrs. Linda.
My doctor gave me a great new product from MRMS Med called the Chondro Tube. I simply apply it right at night to my teeth, and it works toward keeping my bone cartilage cancer-free. I simply take the package out of the tube, break the seal, like so, and apply.
The Chondro Tube works using a special chemical inside.
The chemical is called santonine. It nourishes the cartilage and bones throughout the body.
It attacks possible cancerous cells by marking good cells and destroying harmful ones.
It's a great product.
Possible side effects may include heartburn, nausea, upset stomach, or depression. If any of these side effects start affecting you, consult a doctor immediately.
There's another great product you can use to prevent chondrosarcoma. It is called the Anti-Chondros 3000. It uses the electricity from your home to send electrowaves into possibly affected cartilage.
It works toward sending impulses to possible cancer cells to prevent new cancer cells from being made.
It sends a rather powerful signal, so it is best to keep away from children and animals. Never directly point the nozzle at another person. It may cause them to go into electric shock.
So ask your doctor about the great new product sweeping the nation to help prevent you from getting chondrosarcoma, always available at MRMS Med's products.
We've given you product ideas for preventative cancer products from MRMS Med. They are the Anti-Chondro 3000, the Chondro Tube, and the Carcinomore.
The electrolyte blanket and the PGR daily.
Of course, we all know that the best way to prevent cancer any type is dancing and singing, and that's something you can't sell in stores.